Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, brought to you by the Columbus Community Hospital. We're here in one of the trauma rooms, and I'm joined by Dr. Robert Miller. Doctor, just to talk a little bit about, we're going to talk about what you do, but what is this kind of room used for?
This is one of our trauma bays that we would bring in a person that was involved in a larger trauma, such as a car accident or a farm accident, where we do potential for full resuscitation.
So on a daily basis, what is it that you do? What is this kind of your main stay as far as work goes?
Yeah, so I'm one of the emergency room physicians here at Columbus Community Hospital. I've been here for 15 years, and our typical routine is that we have one emergency room physician on staff at all times, and right now our hours are usually a 12-hour shift, so I work a 9 a.m. to 9 p.m. or a 9 p.m. to 9 a.m. shift. And then for about 12 of those hours, we'll also have a nurse practitioner or a physician assistant with us to help take some of the load of the patients during the day.
Interesting. As far as working those long 12-hour shifts, is that something that I guess over those 15 years you've gotten used to, or is it something that still it gets a little long sometimes?
They're better because they used to be 24-hour shifts, and we've moved them down to 12, so that's much more doable. And you know, it's a busy enough place that you don't want to be doing 24 hours if you can help it.
Absolutely. As far as being here for 15 years as well, what brought you to Columbus, and why have you decided to kind of stay and work here for so long?
My background is in family medicine. I'm board certified in family practice, and I had worked in a small community in rural Kentucky for about 6 years after residency, and then my wife and I decided to move back to be closer to family, and I started to work in more rural emergency rooms at that time, and then as the months progressed, I just ended up signing a contract to work with Columbus, and have enjoyed it.
So are you originally from Columbus then, or where are you from originally?
I actually grew up in Minnesota,
okay.
And then I went to Midland College for undergraduate, and my parents live in Lincoln, or they did live in Lincoln, and then I went to med school at University of Nebraska Med Center, went to residency in Kansas, cool. And then when we decided to move back, we actually moved back to Lincoln. I live in Lincoln and commute to Columbus.
So as far as, you talked about your education too, when you're going through all that, the different stages of education, what is it that brought you or made you decide you wanted to do trauma and do work in this kind of field? Well,
I started with family practice, and I enjoyed that part of it, taking care of everybody from delivering babies all the way up through taking care of older folks. And then when we moved back to Nebraska, I just thought that I would maybe try something a little bit different, and I started doing emergency medicine, and I enjoyed that as well. And so I've been in emergency medicine for the last 15 years. As far as
that you're doing this, do you miss working in family practice at all, or what do you miss from working in that field?
Sometimes you miss the continuity of care of just seeing somebody that you've seen a number of times over the years, and taking care of the whole family. But I get a little bit of that. I also do a concussion management clinic here in the Columbus area, and so I do see some patients more in a clinic setting as well, so that's a good blend.
And it's kind of, it's called trauma for a reason, a very intense unit to work in. I mean, does that take a toll on a while, or does it help to have like a good staff around you when you're working here?
We have excellent staff here at Columbus, and the nurses have been trained in cardiac resuscitation, and they've been trained in trauma resuscitation, and we have good support with surgeons and orthopedic surgeons, and then we have good upline support with the University of Nebraska Medical Center or with Bryan Trauma. So we have a very good setup.
Absolutely. Well, Dr. Miller, I appreciate you joining me here and telling me a little bit more about what this unit is about, and thanks for joining me.
All right, thank you.
Cool. And guys, thank you for tuning in as well to another edition of Meet the Docs, brought to you by the Columbus Community Hospital. I'm Grant Otten. We'll see you next time.